Welcome everyone. Good afternoon. I can see more of you are still landing in the room, so we will start slowly to enable most of you to get in before we get into the detail. It's really lovely to have you all here at our Lunch and Learn session. My name's Julia Slay. I'm going to be hosting this Lunch and Learn, and we mean it seriously. We're using the webinar format, so hopefully you've got a bit of time off camera to enjoy hearing from some of our wonderful speakers and have a bite to eat at the same time. So this is the third event in our gathering this week as part of the Health Anchors Learning Network, and it's a session that I'm really excited about, learning from anchors in other sectors. So the kind of anchor organizations concept is not just happening in health. There's loads of exciting activity in arts and culture, in housing, in higher education. And today we're going to be hearing a little bit about how it's been embedded in those sectors and what that looks like. So this is who we're going to be hearing from today. Really, really wonderful range of speakers. We've got Professor Jane Robinson, who's at Newcastle University, Pro-Vice Chancellor of Engagement and Place. We've got Sinead Butters, who's the Group Chief Executive of Aspire Housing, and Louise Wolsey, who's Chief Transformation Officer at the London South East Colleges. So really interesting mix of perspectives from a range of sectors across the country, all England based. And we're going to be hearing a little bit from each of them and then doing some Q&A with all of you too. So that's what you've got to look forward to. Just to kind of set the scene, I'm sure there's lots and lots of people dialing in today who are really familiar with the concept of anchors, but we just wanted to make sure that we've shared a kind of definition up front so that we're all holding that in mind, really. So what we've been using to describe it is thinking about anchor organizations as large public sector or not-for-profit institutions rooted in place. So often very connected to a physical community, either because they have really significant assets there, because they're delivering services there, or because they're geographically aligned, so like a local authority, housing association, university, schools. And they're anchors because they have a really significant potential economic impact. So all of their assets and resources can be used to benefit the local community. And there's a whole range of strategies that they can use. And we've done an Anchors 101 video resource, which sets those out quite nicely. But some of the most common ones include employing local people, thinking about procurement as a strategy. So thinking about supplies and goods and services which are purchased, thinking about physical assets and how those spaces and buildings that are owned and run by anchors are used by the community, and thinking about things like the environmental impact. And anchors are often among the biggest employers and spenders in their towns, cities and regions, so they really have a really significant impact. So that's our starting point for a kind of definition. Obviously, the Health Anchors Learning Network is bringing together a range of health anchors across the UK. And what we're learning about today is how that concept has landed and travelled into other sectors and what work is going on in those sectors. If we just hop on one slide, Gweno, we wanted to invite you to share as a kind of way of checking into the session in the chat, whether or not you've been working with any other non-health anchors in your local area. So what are the types of anchor organizations, perhaps across some of those other sectors that you've been working with or collaborating with? It's great to hear about what you've been doing. I want to start to gather some of that practice now. So take a moment to add into the chat if you can. I can see there's already some people saying hello and introducing themselves, but take a moment to share your additions, and you can send it to all panelists and attendees, which is a way to make sure that everybody can see it. So what other anchors outside health have you been working with? Great. Housing associations, football clubs. Interesting. Absolutely brilliant. And I'm based in Tottenham, so good to see that someone else is local. Brilliant. Further education colleges. Great. Interesting. Nuclear sector. Don't necessarily know their anchors. Universities, social enterprises, housing associations, funders. Absolutely. Some towns, cities, regions have got place-based funders, and that they're often really important anchors. Education coming up a lot. Great. No one's mentioned arts and culture yet. That's another often really big anchor organisation, maybe museums or galleries. Local authorities has come up, third sector, yeah, council, absolutely, voluntary sector partnerships. Brilliant. Some absolutely brilliant police and fire services. Great. Some wonderful examples coming through there. Brilliant. Keep them coming. It's really, really interesting to see the range that you're working with. Education coming out really strongly there, as well as housing associations, which is great. A lot of people talking about local business networks and kind of traders associations as well, which is an interesting one. Fab. And of course, the voluntary sector coming out really clearly there. Brilliant. Okay, well, we're going to move on in a moment to hear from our first speaker. And that's Professor Jane Robinson. So we're going to start with universities, hearing a little bit about what's happening in the university sector and what's been going on in Newcastle. So we're going to hear from each speaker for just shy of 10 minutes, and then we'll be coming to Q&As for the second part of the session. But feel free to add your questions into the Q&A as we go along. So whatever comes up for you, add it in there, and then we'll move into a kind of moderated Q&A session just after 2 o'clock. So Jane, can I hand over to you?
Thanks, Julia, and thanks for that introduction. Absolutely fantastic to see so many examples of different anchor institutions that colleagues are working with, and that's very much been our experience as Newcastle University, working with our partners in Newcastle and the region. I'm just going to spend a few minutes sharing some of the experiences for higher education in a national context, and then maybe explaining some of the work that we've been doing in Newcastle with our partners, and finally just a specific example which I hope is of interest in terms of the way we've responded to the pandemic working together. I mean, I do think it's definitely a time when, although we've talked about the idea of anchors as a concept for some time, I think the idea of anchor organisations, institutions in the context of place is something that has really come to the forefront in the last year or so, and it's fantastic to have the opportunity to speak at this network event and to be able to share learning with colleagues. So I absolutely think that this is key, you know, how we share our experiences and build linkages in really practical ways that are going to benefit local communities. From a university point of view, I think that sort of focus on place, on the role that we have in society as anchor institutions has definitely really moved up the agenda. A couple of years ago, we worked with Sir Bob Kerslake on the Civic University Commission, which some of you may have seen, but we can share the link to that. And that led to the establishment of the Civic University Network, which is hosted by Sheffield Hallam University. Newcastle University is one of the founder partners, and that's really about bringing together universities with other partners in different sectors to share learning and to help shape and influence policy and best practice. There are over 70% of the UK's higher education institutes are members of that network, and we only launched last May, but we've been doing a number of events focusing on different areas, culture, and we're doing a lot of work with the NHS Confederation at the moment about the relationship with the NHS, thinking about the economy and recovery and how we work together. So a lot going on there. There's also over 60 universities who've signed up to develop what's called Civic University Agreements, which is really setting out with our partners how we are making a contribution to local places. So there's some quite interesting examples of how we measure impact and work on that. I guess to say a little bit about, so what's that look like in Newcastle? I think it's fair to say that as a university, Newcastle has worked with our partners a lot over many, many years. Indeed, we were founded by the pioneers of the Industrial Revolution. So we're firmly rooted in our communities and place. But we have really built on those partnerships in recent years, and in particular have developed an approach called Collaborative Newcastle, which brings together together our anchor partners in local government, in the NHS, and with universities and business and local communities, to really think about how do we work together to make Newcastle a place which is links together health, wealth and well-being. It's a real sort of systems-based approach, and we've done that within a framing of thinking about people, planet and prosperity. So we've got a huge amount of work which has been going on in relation to health and social care integration that has really been driven forward quite remarkably in the last year or so. We've got a pillar of work which relates to growth and economic prosperity, and then a range of work that links to the planet in terms of net zero and climate change. And I think what's really interesting is sort of seeing, particularly in the context of COVID, how we've been able to bring partners together to understand the needs of the local area and local communities, and really think about how do we innovate and think differently about service design and delivery, and bring in the innovation from universities through research, as well as the contribution that our students can make to really understand the place. So it is that kind of combination of working together. The specific example that I wanted to share with you, and there are many that we could talk about, but the one that I really thought was a good example and very timely is the work that's been done around developing an integrated COVID hub for the North East. And this is not just about responding to the immediate challenges of the pandemic, but also about how we have an integrated approach to looking to the future, so that we are very much a global leader in terms of the fight against virus spread in the future. It's got three components. One is around fast and accurate testing, so that the Lighthouse Lab. The next element is about real innovation and cutting edge science, working with the universities through an innovation lab. And the third is around robust analysis and response. I think it's important to say that this, I think, is a sort of a unique approach to bringing all of these different aspects together, led by the public sector, but working within industry. It's a partnership between the NHS, the university, and local governments. But what's been really important is that we've focused on how to maximise local value. So we've thought about the approaches to procurement, for example, as you were talking about, Julia, but also about local staffing. And I think one of the things that we're really proud about is the diverse staffing model that's being pulled together to support that. So we've got over 1,000 people who've been employed, many of those from local communities and diverse backgrounds, as well as thinking about how we organise student placements and how do we actually engage local people in this. So there is a potential long-term benefit in creating local jobs, but also thinking to the future and how we can innovate and make sure that we are in a really strong position around addressing challenges of the current pandemic, but also any that may come forward in the future. So I think I'm conscious that we've got a lot to get through, and I'm really keen to hear from the other speakers and to have the questions. So I will draw it to a close there. I do think that now more than ever, there is a time for us to sort of think about our shared values, our focus on what we do as anchor institutions in terms of our places and the communities we serve, and that actually there is a lot that we can learn from each other to make a real difference. Thank you.
Thank you, Jane. That's really helpful. And I know many people in the kind of audience, people who are watching, have been working closely with universities. But for those who haven't, hopefully that's given you a real sense of what's happening in that sector, and kind of some of the ideas that university colleagues you might have are working on at the moment. And obviously there's that thriving network emerging in universities too, which is fab. We're going to move on now. I'm going to bring in Sinead. Welcome, Sinead Butters. Do you want to say hello and introduce yourself and talk a little bit about the work that you're doing as an example of some really brilliant stuff that's happening in housing?
Great, thanks, Julia. Yeah, and really appreciated hearing Jane's comments about the university world and the link to the civic universities. So thanks for that, Jane. Yes, from a Aspire housing point of view, I'm Chief Exec of Aspire. I've been with the business for over 20 years now and Chief Executive for the last 15. And we're based in North Staffordshire. And some many years ago, probably shortly after I joined, we asked ourselves what our purpose was and what we were here for. Because in my world, you can, as we say, tart up the houses all day long. But actually, if people are living less than good lives in those houses, then what is the point? So in order to kind of fulfill that ambition, sometime probably 2008 now, we bought a training company, and that training company was called PM Training. It's now called Achieve Training. And in that time, I think every year we've been training something like 2,000 to 2,500 people each year, some young apprentices, mostly actually those who are kind of furthest away from the world of work. And we bring the group together in three parts: the Aspire Housing, which is what was a stock transfer. Newcastle Borough Council sold its properties to us, so it's a stock transfer with concentrated properties in neighbourhoods across Newcastle. We operate, and that's Newcastle under Lyme, not upon Tyne, or Jane and I would know each other better, I'm sure. Although Keele University is a close anchor partner with us. And the group has got three parts to it: the housing part, the training part, and our charity Realise. And our training part is a private training provider that makes a profit each year, and that profit goes into our charity Realise to help people into realise their ambitions, help them into work through breaking down barriers and giving them a start in life that neither of those two businesses would do. So Aspire as a business is a over £50 million turnover business. So we're kind of pretty big business where we are. We employ about 450 people, and we're really keen to see that we act as a catalyst for learning, for education, for people to cut their teeth in the world of work. And I can talk a little bit more about that later on. But in particular, what I would like to see about our business and have strived, if you like, to achieve over the years is to act as that economic catalyst, and that everything we do in the way we work, not just what we do, but how we do it, creates opportunities for local people, creates opportunities for local business, and enables our business, if you like, to invest in those communities to help them flourish and prosper, but also in doing so creating those opportunities for people to get into the world of work. So I think about it as 450 hearts and minds and hands and feet and all that capacity, and all of our investment opportunity enables us to say, well, okay, so we've got something like 9,000 homes. How can we make the areas that we focus on better? How can we support the community to get what they want out of where they live? And a lot of the work we've been doing has been looking at the quality of our provision. And I've always said to my team, if you're standing back by something that you wouldn't live in or your family members wouldn't live in, then it's not good enough for us either. And therefore, we've been really challenging about some of our older persons accommodation, our sheltered accommodation. Again, saying, well, if it's not fit for purpose, then we're going to have to find new ways of working. And that often means being able to redevelop our unfit schemes, working with the council, working with our local authority partners and other stakeholders to develop, if you like, master plans in areas that uses our assets, the county's assets, borough council's assets, sometimes health assets, to create a vision of something better that better meets the needs of our community, but in so doing, being able to offer this higher quality product, but through connecting with the opportunities for apprenticeships. So we make sure that we ask our contractors to give us a 1% donation to realise our charity, and we make sure all our development partners give a charitable donation. We're about to really, really squeeze every ounce of capacity out of our numbers. That means going back to refinance our business probably for the third or fourth time in our history. And in the next couple of weeks, we're going out for another £145 million, which will bring the next 5 years worth of investment to about £250 million. And that's going to be £250 million invested in improvements to our homes, but also tackling some of these blighted areas where, if you like, no other developer would do it, because actually when you look at the finances, this does not pay back. It does not pay back over 30 years or 40 years and sometimes 50 years. But if we are not here to help areas flourish, help tackle blight, help create a better environment, then if we're not here to do that, then what are we doing? Because this is what we're about. We're a social purpose vehicle. We're not public sector. We're privately financed, but we have those values, that anchor values about this is our backyard, and no one else will do what we do, and we should make sure that we can do it. So that's everything from sustainability to investment in the stock to our safety work and building safety, and spending that £250 million really well by focusing on our neighbourhood areas, developing neighbourhood plans to be able to say this neighbourhood, through the evidential analysis, through talking to our customers and partners, needs these sort of interventions that might involve specialist housing support. It might involve more work in terms of employment and skills, better use of our assets in that area, redevelopment of some of our schemes, some new build going on, and a whole kind of approach to investment that enables us to then lobby better and lobby locally better, but also work with our local authorities through town deals, which we've got some fantastic local success stories with town deals, where we've got 2 deals in Newcastle alone. High street funds are going in, we're working with those 2. I'm on the local enterprise partnership board, so I'm making connections between, and the local authorities always already there too, making connections between employment and skills and the physical infrastructure investments I've talked about, but also making sure that where we develop these neighbourhoods, we do so in partnership with others, so that we understand the kind of trajectory of the neighbourhood, so that we can help those neighbourhoods have a better and improved trajectory. And wrapping this all around with an employment and skills kind of wrapping, which says that we've got an Aspire to Work programme where we can signpost our tenants to support to get into work, which is confidence building, CV writing, and help job search for them. We've got a team of fully funded people who have got the experience to do that, to help people into work in that way. We offer the apprenticeship programme through our training provider, Achieve Training, which really kind of successfully takes young people who would ordinarily perhaps have fallen out of college or maybe not have achieved their, what they were capable of achieving. And we, with very, very targeted, bespoke, smaller classrooms, off-the-job training, and using Aspire and our associated businesses, contracting businesses, to give them the chance to get a CV strengthened and oversupply ourselves with these young people. We give them a wraparound support that helps them use this as an opportunity to kind of, grow as a person and learn more, and then be able to move on into further opportunities such as jobs and training. We've got business connections, about 1,600 businesses locally, and we work with those businesses to help them move our apprentices that have gone through our records, but also those who have come to our training company and who are looking and are ready to move straight into the world of work. So we set ourselves a target of 10% of our employees are young people. So you go wherever you go in our business, you've got young people who, have just changed the dynamic of the way in which sort of like it feels to work, and our culture in Aspire. So in all, really, it's about having a very clear strategy. It's about making very, very strong connections with your local partners, business partners, and other anchor institutions, about being clear about the contribution you can make, absolutely sweating your capacity so that you've got every pound you can find going back into that community, making the difficult decisions about long-term patient capital, and that's patient as in having patients rather than having patients who are in hospital, and having that patient capital that enables us to take a long-term view about our investments, sweating our capacity, as we've said, and then wrapping back round with the employment and skills work that means that how we do it creates all those supply chain opportunities and really, really kind of, if you like, gets us to sort of concentrated focus in neighbourhoods with nailed on capacity, a long-term sort of business that will operate here for many years to come, hopefully creating a better place and opportunities for people to enjoy a better quality of life.
Oh, fab. Thank you, Sinead. That was a tour de force of a huge amount of work that's going on. Absolutely wonderful to hear all about that, and an example, I think, of just how much housing associations can do on this, and what health partners could be looking for and looking to their housing partners for. Last but not least, I want to bring in Louise Wolsey. Are you there? Cameras on, fab, welcome. Welcome, Louise. So a kind of higher education colleges perspective now. I know you've been doing some really interesting work with health partners locally and on your anchor strategy. So I will hand over to you, and I think Gwen is managing a couple of slides.
Yeah, that's great. Good afternoon, everybody. Lovely to have the opportunity to join you. And I've got a few slides to talk you through the approach that we've taken. And what's fascinating for me today is much of what we are doing builds on some of the fantastic work that's happening within the university sector, and kind of builds on that concept of civic organisations. And interestingly, there's synergy, I think, with some of what Sinead's just spoken about there in terms of the locality of place and the importance of local priorities that speak to the communities that we serve. So I'm going to talk about colleges today, but we're actually an education group. Next slide, please, Gwen, thank you. We have an 8-school multi-academy trust in South East London and Surrey, and 7 college campuses across 3 London boroughs. So we have quite a footprint of estate, about 1,300 staff, 12,000 learners, and a large kind of turnover of about 80 million. And as that has evolved as an organisation kind of footprint, we knew that there was more that we could be doing to inform and support and shape our work going forwards. Education will always be central to who we are and what we stand for, because that's fundamentally our core business. But because of the resources and opportunity that affords us, we wanted to find a way of having a greater impact and make a greater contribution to our communities within our locations. And we wanted to think beyond the core metrics that we would normally use as an organisation in terms of measuring standards, achievement, attendance, retention, all the kinds of things that an education provider, quality of teaching and learning, all the things that an education provider would look at, and that I assume you will have those individual metrics within health, but it's the broader determinants of community value that we wanted to start to kind of look at. And so we embarked on developing a new strategy, which I'm going to touch on shortly and give you a very brief overview of it, so that it brings to life why we've adopted the metrics and the kind of framework for impact that we have. Next slide, please, Gwen. So we launched our strategy in 2019, having consulted with all staff and students during the 18-19 year. And at a glance, there's a short version of this. Next slide, please, Gwen. That brings to life, in essence, why we wanted to be more innovative in our approach and almost borrow, if you like, from the innovation of the social enterprise sector. We're still a legal entity with normal funding contracts with government in the way that every other college and multi-academy trust is in the country, but we have an education group that sits across this, which is not a regulatory group, but which is a management and executive and a governance group, which drives the change through those organisations. For that approach to trying to position ourselves in a different way as an education provider with a more entrepreneurial outlook, I've taken the liberty of including in my presentation today a very short clip of bringing this presentation to life, which we use with our staff and our students. So Gwen, if you would see if our little clip will play on the next screen, that would be great. Thank you very much. Thank you. So I hope that brings to life a little bit about the wider approach that we want to take to creating an impact within our local communities. And we knew that to do that well, we needed to have a sense of how will we make progress, how will we measure that. And so we've partnered with two brilliant organisations who I can't recommend highly enough, the Social Value Portal and the Centre for Local Economic Strategies, who both through their own core roles have helped us be put in place an evaluation framework, which we've now embedded across the every part of our business in terms of our performance management framework, our corporate scorecard for our boards, our careers frameworks for our young people. In essence, the Social Value Portal have adopted something called the TOMS framework, Themes, Outcomes and Measures, which do relate in part to the United Nations Sustainability Goals, if you look at mapping them. The reason why we adopted that framework, although it's not perfect for everybody, I actually think there's an awful lot of value in there for many organisations within the public and community space in terms of identifying with the change and kind of positive outcomes they might like to see within their communities. So we've adopted that framework and been working with the Social Value Portal to make that make sense in our everyday work. And the Centre for Local Economic Strategies have been reviewing how far we've gone on that journey and what more we need to do in terms of implementing this strategic approach more effectively, both within the organisation, because it's continual work in progress. We haven't got it all right. There's many more things for us to do, and most importantly, externally with our local partners beyond the college and beyond the school gates. Next slide, please, Gwen. So simply, this is a very brief simplified version, but there are themes within the National TOMS framework which we've chosen to use because it kind of fits well with how we think about our place, our role in our community, skills employment, growth of responsible businesses, healthier, safer, more resilient communities, and the sustainability agenda, and then obviously social innovation. And linked to all of those, I'll show you a brief example in a moment, are outcomes and measures, units and value. And what we're able to do now is quantifiably demonstrate in proxy value terms the value that we create and the impact that we have locally. Next slide, please, Gwen. And you won't be able to see the detail, but it just shows you the level of detail that sits behind these themes and outcomes in the TOMS framework, which for us, we've been able to use and select what's appropriate, linked to our strategy and linked to our business and corporate objectives. Next slide, please, Gwen. So our journey so far, we've developed those partnerships with two research agencies that have helped us develop this strategy. In our pilot year, just within the college, it was independently verified that we generated £6.3 million of social value. Within the group, in our first full year, then went through to £32 million for the Multi-Academy Trust and the college, and we plan to double that within 5 years. More and more commitments within the organisation across every work strand to embed social value. That's come through our performance management framework, and leaders and teachers and managers are given freedom as to how they will implement that in that area of work. We've started working with the CBI in terms of thinking about the role of social value being embedded in local economic strategies for supporting local recovery and productivity. And interestingly, the work that we've done so far has been recognised by the Social Value Awards, with us winning the Public Leadership Award at the Social Value Awards this year, which we were very surprised at and immensely proud of, because it's been quite a journey for us. Next slide, please, Gwen.
Just another couple of minutes, if that's okay, Louise.
Yeah, sure, no problem. So in simple terms, there's an example of some of the work that we've done and the value that we're able to measure using those metrics. It's always nice to see kind of stats and facts. And then finally, as an example for our health colleagues on the call today, next slide, please. Here's an example of a case study that we've just undertaken with one of our local partners, Oxley's NHS Trust, where, like many of you, facing phenomenal pressures in the past year, and we were able to look outwards during this time, see an issue with our local trust providers, recognise the role that we could play as a training provider, and support in terms of designing, developing, implementing and delivering a rapid employability programme that has assisted them in terms of recruiting from their communities. And I suppose the final point, last slide please, Gwen, thank you. The final point I would say is that why this is really important to us is because we all know that the underlying determinants of health inequalities and life quality ultimately do link back in many times to education, to employment and housing. And although we can't solve all of those issues as an education provider, we can do more than simply train and educate people to pass exams and pass qualifications. It's by, as Sinead said earlier, it's not just what we do, but it's about how we do it, taking those hearts and minds, the hands and the feet with us in terms of the change locally. So that was a lot of information in there. I apologise for that, but I just wanted to give you some kind of nuts and bolts in terms of how we have taken that approach so far. That's finished now. Thanks, Gwen.
Thank you. Thanks so much, Louise. It's really powerful, I think, seeing those measures that you've been developing and the kind of quality of data you've got. Data and measurement has been a big theme coming up throughout the week through the sessions so far, and it's really brilliant to see, you know, how you've started to tackle that. And that case study at the end is just brilliant, you know, really live vaccination program drive recruitment. I want to invite the other panelists to pop your cameras on, Fab, and we will do some Q&A now. There's a few that have come up as we've been going along. Sinead, there's two that I'm going to share with you first, which are specifically on the housing point, and then come to the all the panelists to tackle this kind of question that's come up around how do we collaborate with multiple stakeholders when sometimes we, you know, they may have different aims. So what's the kind of trick to that? But Sinead, there were two that I thought you might be able to cover off quite quickly. One was around whether or not you do housing provision for key workers or are having conversations with local anchor partners about that. And the second was around the asking contractors to donate the 1% to charity. Do they ever push back? Any obstacles in doing that? What's your experience been?
First of all, I'll take the last first. Yeah, I think there's always a pushback if it you know, impacts on people's profit, but we've taken legal advice on it, procurement advice, and you know, we just start the negotiations early with contractors so that they're very clear right at the outset what the expectation is. And so far, it's working. I mean, it's legally binding. It's not a kind of promise or something that is just a kind of goodwill gesture. So yeah, that's working, and it has a track record and has worked in other geographies. In terms of key workers, no, we don't, but other housing associations do. It's not an area that we believe we've got a lot of knowledge in, but we're always looking for kind of opportunities to develop and enhance our you know, a portfolio offer. So yeah, maybe in the future. And if I may, just one quick one. I was asked about doing to tenants or doing with tenants. So our strategy is called People First. It's about putting people at the heart of our business. That's our learners, our customers, i.e. our tenants and our staff. And that we've done a lot of work in terms of Chat to Aspire. We've got the Housing White Paper that is strongly encouraging us to listen to our tenants in the light of Grenfell and the tragedy that happened there. We've got an Oasis group which observes our services and tries to, if you like, drive improvements through the governance frameworks. So we can always do more. We know we're not where we want to be, but we definitely put people first at our heart, and that has to include listening and working with people, not to them.
Thank you, Fab. And so I guess one for the whole panel really, which is, you know, collaborating with lots of other partners locally who may have different aims. What's been, I mean, many of you, I think, talked about sharing common objectives and common ambitions. What's been your experience of getting to the point where you agree on those and kind of can get a sense of what you're all bringing to the picture? I don't know if anyone wants to kick us off with that.
Okay. Yeah, I think it's an absolutely critical area, and truthfully, it's the area where I wouldn't say we're really weak because we talk to people and collaborate a lot, but there's not currently a framework or a vehicle, if you like, by which it's easy for us all to line up. So nobody probably on this call will disagree with wanting to improve health or employment or skills or all those sorts of things locally, but each public sector organisation or civic institution tends to have its own priorities of what it needs to focus on. I often find in education, I've been in FE for 5 years now, we kind of just borrow our way and we do what we think we need to do because that's us as an institution. And I think our job is to stop that, pause, look at and see what role can we play and listen to that stakeholder feedback. So that's an area of our strategy implementation that Claire's is supporting us on in improving.
Yeah, I agree with Louise. It's sometimes a sort of challenge, and I think that one of the sort of interesting and important sort of shifts that we're seeing around more of a place-based and a sort of person-centered approach is sort of trying to put our institutional priorities to one side and thinking about, so, you know, what do we bring in terms of what's going to make a difference to our local communities and place. I think one of there was a question around sustainability goals, and I think a couple of things that we've been doing in Newcastle is we have been using the framework of the UN SDGs, because I think that really helps in terms of having a sort of a framework which many people will sort of understand works locally, but also has a kind of global resonance as well. So we've looked at where the city is in relation to those UN SDGs, and looked at how we can build a local indicator set that's meaningful to the local place. And we've also been developing a policy and evidence hub, and I think that's really important. That's not an academic sort of institution. It is a shared entity which brings together our partners in the NHS, working with the North of Tyne Combined Authority, with Newcastle City Council, and the 2 universities. So Northumbria University is working closely with us on that as well. So that's about sort of how do we really build a picture of evidence about what is needed and how we can make a difference. And I think using that to help drive shared priorities is important.
Thank you. Sinead, did you want to come in at all on that kind of collaboration point?
I think it's a really difficult one. I know that, you know, my kind of take on it is you persevere, you have honest conversations, you know, you talk to, I think for me, you know, chief execs of local authorities to be able to say, you know, like, this is how it's feeling, this is why we need to work here, and this is the way in which you can enable us to work with you. Having endless amounts of patience, and then just getting on and doing it, and then, you know, the build it and they will come kind of mentality. Because if we'd have waited for other partners to come on board with what we were doing in the early days, then we'd still be waiting now.
I do think, if I can, Julia, I know we're short time, but, you know, I think there is this sort of sense at the minute where, you know, for many of us, we are quite tied by national policies and regulatory frameworks that in many ways mitigate against local collaborations. And I think increasingly what we're seeing is a recognition that actually, if you do want to get stuff done, you do need to be able to collaborate and be quite brave and bold about what you can do locally, and just crack on, frankly.
Lots of nods there from the other panelists too. So we've talked, you touched, Jane, on the sustainability questions. There was a question around kind of how has sustainability featured in your thinking as an anchor, and I know you mentioned net zero and some other kind of objectives. I wondered if any of the other panelists wanted to come in with whether or not your thinking has touched on this, or it's a kind of area that you know you want to pay more attention to.
So from a housing point of view, it's a massive unexploded bomb in terms of housing. I think something like 190 million for our stock to bring it up to net carbon zero by 2050, and the money's not there, and the money's not available. So, you know, the government, and rightly so, is charging us with trying to tackle the housing crisis and building new homes and building safety. And the investment in building safety and new homes and tackling sort of the poorest kind of type of provision. At the same time, we've got our own sustainability goals, which takes up to 2030, which are fully funded in our plan. But the actual leap to net carbon zero is, at this moment, unknown as to how any housing provider will get there.
Very challenging.
I think it's a great example. I mean, as a city, Newcastle was one of the first to have the anchor institutions of the Hospital Trust, the university and the City Council declaring a climate emergency, and we all have plans to get us to net zero by 2030. And it's one of the key strands of the anchor institutions working together on our sustainability plans. So we have Newcastle Net Zero is one of the 3 pillars that I was talking about, and one of our academics is co-chairing that action plan delivery task force with the leader manager of the city council. So I think there's a kind of, there's that structure in place. But, thinking about housing, it is an example where anchors come together. So as a university, we're looking at research around different types of energy and energy systems integration, like hydrogen, working with the local colleges on how you can address the skills needs for retrofitting that housing stock, and that's making a real difference in the local area. And I think it's a lovely example of where different expertise and capabilities can kind of come together to address some of these big challenges that make a huge difference. And if we think about health and well-being, actually the quality of your housing stock is a key part of that.
Brilliant. Okay, couple of other questions. We've got about 5 minutes or so do keep, those of you watching, do keep chucking in questions if you've got them. There's an interesting one about the measurement of social value and the kind of, how do you begin to start to quantify that? And I know you've been on quite a journey. Louise, you might want to kick us off on this, and then I'll hand over to others in the panel. But, that's potentially quite a big piece of work. So how have you approached it?
Yeah, it is a big piece of work, truthfully, and it's a continual journey. Like I said earlier, that for us, and as a start on this journey, Tom's framework was helpful in the sense that so much work and evidence and data and rigor sits behind that framework already in terms of metrics, which speak the language of government, bluntly. As a sector, further education, and perhaps it's the same for others, don't always articulate back to the taxpayer or back to Treasury the kind of value that is created. And so the interesting thing about having a proxy value for social value in that way, linked to all of those metrics, is it really helps. And what we did was effectively thought, what change or what type of community or place would we like to see in the future, and those themes speak to it. And then we've selected out metrics that we think actually our bodies of work could assist us on, in terms of this is what we do. So, our employability programs, thousands of our young people go out on work experience, that's all got a metric attached to it in simple terms. The other thing I think, which is kind of interesting linked to the measures, is that you quite quickly then start to see how those could all add up to outcomes. So I was talking to a local healthcare provider about their strategy going forwards over kind of the next few years. And in essence, they want to recruit locally. We're not always talking about the highest level clinical roles in health. It's often business support, estates, facilities management, HR, IT. Many other related or call centres, many other related schemes, which if we can modify our approach strategically in having this approach, and then modify our offer, it ends up helping on multiple outcomes for the future for those health anchors who are under pressure always to recruit in the right way. So, much of our work has been on our core provision. What do we teach? What do the qualifications relate back to the local employment and skills needs, and that plays into the measures again.
Yeah, I mean, I think it's really the whole how we measure the impact is a huge challenge, but I do think that there are some existing things that we can use. I think as Louise and Sinead suggested, actually, as big employers, how we work, how we operate makes a massive difference. So things like Real Living Wage Foundation accreditation, using the Social Value Act in terms of the way we handle our procurement. There are lots of ways, I think, in which we can sort of say, actually, our commitments to some of those existing frameworks is a really good way of measuring the impact. And if you start to add that up across a city of the anchor institutions, the numbers are phenomenal, really. And the difference that you can make by just being a good employer is really significant.
Absolutely.
To add to that, I think I'm probably, I totally get the work that Louise has done and respect that work. I think that from my point of view and from my organisation's point of view, that we've done a lot of different social value measurements and tried to measure the impact strategically of our organisation over, say, a 12-month period with housing and employment and training. And we found that there were so many different ways to measure and so many different organisations quoting their numbers back, that it felt like for us, it was discrediting the work we were doing, because it was like, pick a number, any number, and justify it. And therefore, the challenge back to us is that I think that if we were able to, and we are able to, maximise every pound we build, every pound we've got to build and to invest and to create jobs and opportunities, then in my opinion, then that is the best thing we can do, and that's what we spend our time and resources doing. And that actually, I feel quite frustrated that we're in the sort of world that we have to do what Louise is doing so assiduously to try and prove our worth, when really, you know, it's screamingly obvious what our worth is, because you meet people, you see it on the ground, and that's what I'm focusing on now. I don't want to spend a lot of time on measuring that. I want to just be more vocal about what's great about what we do and demonstrate it evidentially. But it is not discrediting what Louise has done, because everyone's different, and every partnership and environment you work in is too.
And I'm going to come back to you in a moment, Louise. I'm just going to say I'm going to wrap up in a moment by inviting each of the panelists just to share any final thoughts or reflections and/or, you know, nuggets of wisdom for health anchors listening about how they might want to work with some of their higher education, university housing partners. So, Louise, do you want to kick us off with that final?
Do you know what, I absolutely agree with you, Sinead. You know, it is a bit clunky, but do you know what's a starting point? And what works is because in our sector, data is king. You know, there's measurement for everything, and it speaks to the culture of where the organisation is at the moment, but takes them on the journey of being really excited actually about what, like you're talking about, in terms of the change that you see in people. And I think probably in 3 to 4 years time, that might still be a feature of our work, but not quite so prevalent in terms of being able to demonstrate and articulate it, because it will be coming through the other outcomes. So I'm with you, we just got to catch you up.
Fab. Okay. Who wants to come in next? Jane, do you want to share any final reflections?
I think just to thank you for pulling together what's been a really interesting session. It's been great to hear from colleagues, and you know, from a university point of view, we are charitable organisations. We exist to benefit society, and I think this conversation has just really sort of reinforced that, you know, it is through collaboration with our partners as anchor institutions, working with local communities, that we can make a difference. And I think that's even more important than it ever has been.
Thank you. And Sinead, any final thoughts from you?
Similarly, really, I think it's great to share. We've never got enough time, you know, and I think when we were asked what about sustainability goals, I think that was a really great question. I thought, yes, what about sustainability goals? And I'm thinking, I haven't got time to talk about a tenth of what we're doing. I'm sure Jane and Louise similarly have got the same kind of challenge. So lots to say, so little time, but yeah, I've really enjoyed it, and I've really enjoyed listening to Jane and Louise too. So, and thanks to everyone for the questions, really great questions.
Well, we've loved having you here. I mean, it's been absolutely fascinating, and I know that there's so much more that you all do that I've heard about that we'd love to share. So we'll have to find a way to get you back involved in future events. For the panelists, it has been absolutely wonderful to have you. Thank you to all 3 of you. It's been really brilliant hearing about the work that you're doing. Makes me super excited about what health partners have to look forward to with the other anchors that they could be working with locally. And really, really, really hope we can keep you involved in the network and get you involved in future events, because there's just so much happening locally. It's been great to hear about it today. Some interesting things coming through in the chat. Yeah, brilliant. The poll has been done. So just again, a big thank you. Thanks for the checkouts, everyone. Keep adding them in. It's really, really helpful for us to hear about what you're taking away from the session, what you found useful. Lots of enthusiasm coming through here, which is great. And thank you to our panelists. And once you've checked out, feel free to go about your day. And we look forward to perhaps seeing you at one of the other events this week. We'll keep the room open for the next minute or so, just for anybody still writing. But looks like lots of useful learning being taken out of the session, which is fab.